Good evening. My name is Rebecca McGurn, I'm a nurse practitioner student with ECPI University. And tonight I will be doing a presentation on taking action in the Michigan opioid law and how we can use the Michigan opioid law to help other states also create laws against opioids. This presentation was compiled by Jennifer Hatcher, Rebecca McGurn, and Padita Rezabakhshpour. We chose to split up the assignments equally and to have one person do the presentation. A summary of the opioid issue. The opioid epidemic is a problem that has affected the United States as a whole. In order to better understand the opioid epidemic, a clear understanding of what opioids are and how they affect the body is necessary. Opioids are chemicals that react with the opioid receptors located on the nerve cells of the body and brain. When used for short periods of time, opioids are generally safe and are a good source of pain relief. Due to the euphoria that opioids can give, they can become highly addictive and can lead to overdose and death. Opioids fall under several different categories. Some forms of prescription pain medications are considered opioids. These include narcotic medications such as oxycodone, hydrocodone, morphine, and many other medications also. Some illegal drugs, such as heroin, also fall under the category of opioids, and there are some synthetic drugs now out there, such as synthetic fentanyl, that are also considered opioids. Short-term side effects of opioids include pain relief, drowsiness, lethargy, feelings of euphoria. Long-term effects of opioid use may include nausea and vomiting, abdominal distension and constipation, liver damage, and development of tolerance, dependence, and addiction. Some side effects of opioid abuse may include drowsiness, paranoia, respiratory depression, respiratory failure, and ultimately it can lead to death. Next, we're going to go over a summary of the actual issue in Michigan. Michigan is one of the many states that has taken strides to try and combat this epidemic. Michigan's death by opioid-related deaths rate is higher than the national average. From 1999 to 2016, the opioid deaths in Michigan increased by 17 times, going from 99 deaths in 1999 to 1,699 deaths in 2016. In 2017 alone, there were 2,794 deaths by opioid overdoses in Michigan, which meant that there were more deaths by overdose than there were from car accidents in Michigan that year. 1,941 of these deaths were from opioid overdoses. 1,295 of these deaths were from synthetic narcotic overdoses such as fentanyl, and 699 deaths were related to heroin overdoses. There were 11.4 prescriptions for painkillers written in Michigan in the year 2015. That equals 115 opioid prescriptions per 100 people in the state of Michigan. According to the Michigan Department of Health and Human Services, Michigan was ranked 18th in the nation for opioid-related deaths in 2016. Who does this issue impact the most? The opioid epidemic can affect anyone at any age. The age group that has the highest incidence of opioid overdoses are young adults between the ages of 18 and 25 years old. Other groups of people that have higher rates of opioid overdose-related deaths include those that use illegal forms of opioids and those who misuse and do not take their prescription opioid medications as prescribed. Certain medical conditions such as sleep apnea and kidney and liver failure can also increase the rate of opioid overdoses and deaths. Those patients that combine their prescription opioids with other medications that cause respiratory depression, or they combine it with alcohol, are at higher risk for opioid-related overdoses. And adults over the age of 65 make up the second highest age group at risk for opioid-related overdoses and deaths. What is the background of the issue and how did this become such a large nationwide epidemic.
It's 9
The
o'clock.
opioid crisis began in the late 1990s when pharmaceutical companies assured prescribers that opioid pain medications were completely safe and would not become addictive. Healthcare providers then began to prescribe opioid pain medications at a much higher rate. Prescription opioid sales more than quadrupled from the years 1999 to 2014. Opioids soon began to be misused and delivered legally by the public before the healthcare industry realized just how highly addicted these substances were. As a result, opioid overdose rates began to increase rapidly. In 2015, more than 33,000 Americans died from opioid-related overdoses. Approximately 21 to 29% of patients that are prescribed opioid pain medications misuse them and become addicted to them. Many of these patients end up transitioning from prescription opioids to illegal opioids like heroin. 80% of heroin users admit to starting their addiction with prescription opioids first. According to Carol Boyd, who has done over 40 years of research in the field of substance abuse and addiction, she states, every drug comes with a risk, but what sets pills apart is their availability. People often perceive controlled medications as completely safe, a belief that may stem from the way in which pharmaceutical companies advertise these products to consumers. Next, we're going to go over a summary of the policy that affects this opioid issue in Michigan. On December 27, 2017, the Lieutenant Governor of Michigan signed into law new requirements for physicians and medical practices to help fight the opioid epidemic. The first new requirement involves the prescribing of opioids to minors. Prior to prescribing opioids to a minor, a physician must now obtain an informed consent from the minor's legal guardian. The consent must contain information about the risk for addiction and overdose, the increased risk for addiction for patients with mental health disorders, and the dangers of taking opioids with alcohol and certain other medications. The new law also requires adults to sign an informed consent as well prior to being prescribed opioid medications. Their consent contains information on the dangers of addiction to opioid medications, how to properly dispose of unused opioid medications, a warning that the illegal delivery of opioids in Michigan is a felony, and the risk for neonatal abstinence syndrome in unborn fetuses. The law also made it mandatory for providers to check with the Michigan automated prescription system prior to prescribing opioid pain medications to patients. New limits were set on how many opioids a prescriber could prescribe for acute pain. They can now only prescribe a 7-day course for acute pain and a 7-day time period. Another change in the law was that a dose of opioid pain medication Another change in the law was that a prescriber could no longer prescribe opioid pain medications unless they had what they're calling a quote-unquote bona fide provider-patient relationship. What this means is that there has to be a counseling relationship between the prescriber and the patient, and that the prescriber must provide follow-up for the patient or a referral to an accessible primary care physician prior to prescribing opioid pain medications. Lastly, if a provider cares for a patient that has overdosed on an opioid, the provider is required to give the patient information on substance abuse disorder services available in their area prior to discharging the patient. What are we proposing for policy changes? We are proposing to encourage all states to establish a safe opioid prescribing practice, similar to what Michigan has put into law. By examining opioid policy changes such as the one Michigan has implemented, other states could adopt similar policies to greatly limit the number of opioids prescribed to patients for acute pain. The idea behind the law is that fewer opioids will mean fewer chances to abuse them. The alternatives to not passing initiatives against overprescribing opioids for acute pain will lead to increases in overdoses, misuse, and deaths related to overdose. How are we wanting to implement these alternatives? Some states are promoting programs that encourage the use of alternatives to pain control. Marijuana has been shown to alleviate some severe pain and other symptoms of chronic medical conditions. Opioid alternative laws and programs are increasing. Many have considered the marijuana to be an alternative. States are now signing bills that are allowing physicians to offer medical marijuana. 31 states in the United States have medical marijuana programs now. Other alternatives to combat the opioid epidemic is for physicians to think of other pain remedies such as nerve blocks, trigger point injections, lidocaine patches, nitrous oxide, and also combining Tylenol and Motrin for pain relief. What are some advantages to this change, to the new opioid laws? States have the ability to create policy initiatives to curb this epidemic. Regulating the prescribing rules of prescribers for acute pain management has many advantages. Some of the advantages are they would encourage more detailed reporting of overdoses. They would increase awareness for other prevention programs. They would share the data, improving multi-state surveillance. They would help to enhance the drug addicted monitoring programs. They would help with early identification of risk factors for fatal overdoses. They would help with identifying opportunities where Narcan can be given to first responders for early intervention. It would help to provide resources and support for decreasing addiction and overdoses. And lastly, it would enhance the use of evidence-based prescribing practices. Michigan has taken some of these steps to set forth policies to control the opioid addiction epidemic. These programs will save lives. In the future, more laws may come to regulate the use of opioids for chronic pain. Enhancing programs to prevent overdoses gives communities the resources needed to reach more people. As you can see in this graph, what the leading cause of overdose in Michigan has been the prescribed pain medications, the prescribed opioid pain relievers, as it is the dark black line. What are some disadvantages that we are saying that may come about by doing these opioid laws? Many adversaries exist against controlling opioid prescribing laws. Will these laws drive patients to more illicit drug use? Not all physicians support the government's hand in controlling the right to treat patients. The plan avows no metric for success other than reducing certain measures of prescribing, stating that neither patient access to care nor patient health outcomes are mentioned. That's according to Thatcher. Many believe that the government forcing restrictions on prescribers comes at the expense of the patient. Some believe that the laws will limit the access to pain control for chronic pain. They believe it may lead to abuse of other medications and increase the use of marijuana. They believe that it may affect people who really need opioids. Many believe these policies are a one-size-fits-all response, not allowing prescribers to decide who needs what. People may start to pursue illicit drugs instead of going to their prescriber for their pain medication, for their pain control. And it's also thought that these new laws may increase suicidal ideations amongst those seeking pain control that can't get opioids. What is the cost of the policy? Regardless of numbers reported in different studies, the opioid epidemic is growing at the cost of American lives, productivity, and tax dollars. The rising numbers of overdoses impose a significant economic burden on the healthcare system. The costs come from both overdoses and other consequences of drug use. According to the Center for Disease Control and Prevention, they estimated the cost of the epidemic to be $78.5 billion in 2015, and that has only increased since then. What is the process that we are proposing in order to evaluate the change and how well this policy is working? In order to evaluate the policy change, we need to collect data before the policy or change has been implemented, as well as data after the change has been implemented. This can take a period of several years, but it will provide enough data for analysis. Policy evaluation uses a range of research methods to systematically investigate the effectiveness of policy interventions, implementation, and processes, and to determine their merit, worth, or value in terms of improving the social economic conditions of different stakeholders. Evaluating policy change is more like the nursing process. You identify the problem. You then brainstorm the ideas for change. You implement the change. You gather data. You evaluate the change, and then you make additional changes based on what your analysis reveals. In order to implement these laws, we need the help from policy supporters. Who we are seeking help from are state and local government officials, insurance companies, drug manufacturers, medical care providers, and most importantly, our patients. Change can happen. Simple things as calling up state reps and local government officials and writing to legislators are all ways that we can do to get the attention of the officials for issues we want changed. In conclusion, the opioid-related overdoses and deaths in the United States have become a national epidemic. The state of Michigan has recently taken strides to help combat the problem in their state by putting into law new guidelines for prescribing of opioid pain medication. Hopefully, our goal is that other states will follow in Michigan's footsteps and take their own strides to implement safe opioid prescribing practices in their states as well. The implementation of alternative pain relieving methods for acute pain is one way to help decrease the number of opioids that are available out on the streets. As practitioners, it is our job to help protect our patients and our communities at all costs. One way we can do this is by fighting the opioid epidemic and abiding by the new laws that are put in place in order to help decrease the number of prescription opioids available to the American population. Thank you for your time.